Hello, I'm Marianne Dalzell, and I am the past clinical director of the Rehabilitation and Exercise Oncology program at Hope and Cope in Montreal. The next topic that I'm going to address is whether age is related to greater risk of bone deterioration when you have cancer. And the answer to that question is yes. Age is very much related to whether or not you're at greater risk for deterioration of your bone. The average age presently of all cancers is still 62. And it is at that age that particularly women, who are always at greater risk, that most will already have some signs of bone deterioration or demineralization, some osteoporosis. Therefore, adding the chemotherapy treatments and the treatments of cancer, adding the element of corticosteroids that are commonly used for nausea and for loss of appetite. Corticosteroids are commonly used as supportive care in cancer. Those elements, plus hormone blocking elements, all can contribute even greater to what would be a normal bone loss. So that if we look just at postmenopausal women as an example, after the first year of treatment, the average degree of bone loss after you've received your chemotherapy, within 12 to 18 months, they have already shown a 3% increase in bone loss. And when you look at the same population of patients going forth another 2 to 3 years, the percentage increases up to 6% bone loss. So it appears to be post-treatment. It's not during treatment. It's not an immediate effect that's reversible within the short term. It appears to be a process that has started after you've received your chemotherapy and continues to affect your bones. So this is something that has just recently been recognized as a concern for postmenopausal women. But there's also another category of patients that may be at greater risk for their bone health, and that is not only women but men who are very young at the time of diagnosis of what we call hormone-sensitive cancers. And this could be prostate cancer in men, ovarian cancer in women, and breast cancer in women. Those three cancers are commonly treated, particularly if you're younger at the time of diagnosis, in a very aggressive manner. So that the chemotherapy, given the chemotherapy regime, tends to be more rigorous and more prolonged commonly, because they want to ensure a survival. So that combination of treatment that is more aggressive, as well as the fact that the hormone blocking agents in someone who is premenopausal, the effect on the system is that much more magnified. You are putting women into immediate menopause, and you are, in the case of men, the degree of testosterone is also being manipulated so that these hormones do not feed the cancer. So the important factor here is that hormones play a large role in bone health going forward, and it's likely as a result of, again, the combination of toxic chemotherapies, which have an effect on the bone health, combined with hormone blocking agents, combined with potential disuse because you're not feeling very well during this entire process, and many of you will have reduced your levels of activity, which is exactly contrary to what the bones need. So looking at all of these factors, and absolutely age plays a great role, because again, the younger patients will be more affected by the aggressivity of the treatment and by blocking the hormones, put you into early menopause, and therefore the normal risk of osteoporosis is elevated. But postmenopausal women particularly, and even some men, will already have had some bone denurturing, and the addition of chemotherapy and potentially radiotherapy will cause greater bone loss. In summary, as to whether or not age plays a role, absolutely age does play a role in whether or not you're susceptible to bone loss when you've been diagnosed with cancer.